Today we will learn the anterior compartment of leg as well as the dorsum of foot. Anterior compartment of leg has got four muscles, that is the tibialis anterior, extensor digitorum longus in black color, extensor hallucis longus in blue color, and peroneal tertius in white color. So all these are four muscles which constitutes the anterior compartment muscle. There is something specific about this muscle, that it occupies only the lateral surface of the tibia and the medial surface of the fibula. This is the right lower limb. So this is medial. Here is the medial and here is the lateral. So if we took the cross section of the tibia, there is medial surface and this is lateral surface. Again, fibula is triangular in cross section. It has got medial surface and this is the lateral surface. So only one muscle is attached on the tibia, that is the tibialis anterior muscle. Tibialis anterior muscle takes origin from the upper two-thirds of the lateral surface of the tibia. This is medial surface and this is lateral surface. So upper two-thirds of the lateral surface of the tibia and get inserted into the base of the first metatarsal bone, dorsal aspect. This is the dorsal aspect and this is the plantar aspect. So it is attached at the dorsal aspect. Here lies the metatarsal bone, first metatarsal, second, third, fourth, fifth. So first metatarsal bone, here is the apex and here is the base. So base of the first metatarsal bone at the dorsal aspect, as well as the medial cuneiform bone. Here lies the tarsal bone, first calcaneum, and over the calcaneum there is talus, and in front of the talus there is, on the medial side, there is navicular bone, and in front of the navicular there are three cuneiform, that is the medial cuneiform, intermediate cuneiform and the lateral cuneiform. And on the lateral side, in front of the calcaneum, there is cuboid, which is somewhat longer and parallel with the navicular bone and along with the cuneiform bone is somewhat longer, cuboid bone. So this tibialis anterior muscle get attached at the navicular bone also. Now second muscle, extensor digitorum longus, it arises from the upper one-fourth of the medial surface of the fibula, upper one-fourth, as well as the middle two-fourth. This is middle two-fourth anterior segment of the medial surface of the fibula. Middle two-fourth medial surface of the fibula is divided into anterior half and the posterior half. Extensor digitorum longus is attached on the only the anterior half segment of the middle two-fourth of the medial surface of fibula. Now get inserted as a four tendon. It gets four tendon and it is attached on the dorsal aspect of the base of the distal phalynx of lateral four toes. This black one. Okay. Now coming to the third muscle, that is the extensor hallucis longus. It takes origin from the middle two-fourth of the medial surface of fibula, but the posterior half segment of the middle two-fourth. And now it takes somewhat oblique course and then it get inserted on the base of the dorsal aspect of the distal phalanx of great toe. Okay. Now fourth muscle is the peroneal tertius in white color. It takes origin from the lower one-fourth of the medial surface of fibula. Here is the, now it get inserted onto the base of the dorsal aspect of fifth metatarsal bone. Here it lies on the first metatarsal and this is the fifth metatarsal bone. Dorsal aspect, base. Now regarding its function, we all know that the muscles which runs from the extensor or flexor aspect of any joint decides its function. So it is running through the extensor aspect of the, or you can say dorsal aspect of the ankle joint. So these are the extensor, or you can say here at the ankle joint there is extension and flexion, and extension is and also known as the plantar flexion and dorsiflexion. So the right term will be dorsiflexion. So all these four muscles are, as it is running on the dorsal aspect of the ankle joint, so these all are dorsiflexors of the foot, like this. This is the dorsiflexion. And there is also two movements at the ankle joint, that is the inversion and eversion. Inversion is the facing of sole towards the midline axis. This is the right lower limb. So if palm will face towards the medial aspect, then it is called inversion. And if this sole will face towards its lateral aspect or outer aspect, then it is called eversion. Sorry, this is sole. Okay, so if sole will face towards its inside, then it is inversion, and outward eversion. So the tibialis anterior muscle, it lies on the medial aspect, so it is inverter of foot, also the inverter of foot. And this peroneus tertius, white color, it lies on the lateral aspect, so it is also everter of foot. This is inverter and this is everter, and all are the dorsiflexor of the foot. Now coming to the arterial supply and the innervation. Arterial supply is by the anterior tibial artery. This is our anterior tibial artery. Anterior tibial artery is the branch of the, it is the continuation of the popliteal artery, further gives anterior tibial artery and the posterior tibial artery. Okay, now anterior tibial artery, what we are seeing here, this one is the femoral artery. Okay, femoral artery. Through the fifth opening of the, this is called the adductor hiatus. This is adductor hiatus. Femoral artery passes into the popliteal fossa behind. You can see it here. By exiting out from here. Now it is termed as the popliteal artery. Now popliteal artery again here, divided into two. You can see here the popliteal artery. Just wait a minute. Here is the, it is opening here through the adductor hiatus. It is coming into the popliteal fossa. So it is popliteal artery, and again it is dividing into the anterior and this is our posterior tibial artery, and this is this is the posterior tibial artery and the anterior tibial artery. Anterior tibial artery again coming from the anterior aspect. Here is our anterior tibial artery through the upper portion of the interosseous membrane, It is coming out anteriorly and running in the over the interosseous membrane on the anterior aspect along with this deep peroneal nerve. This is our deep peroneal nerve. So, anterior tibial artery, it gives recurrent branches. Recurrent branches means taking backward course. This is the medial aspect and this is the lateral aspect. So, superior medial and superior lateral recurrent branch, anterior tibial recurrent branch. And here is the malleolus. Here is the malleolus, medial malleolus and the lateral malleolus. So, medial malleolar branch and the lateral malleolar branch. And these are the muscular branches going to the supplying the muscles of the anterior compartment of leg. This one is for the extensor digitorum longus, this is for the tibialis anterior, this is for the extensor hallucis longus, and this is for the peroneus tertius muscle. Now after the ankle joint, it is named as the dorsalis pedis artery. Now in the exam, the examiner will ask you how you will palpate the dorsalis pedis artery. So just when it passes in between the, here you can see this red one is the our dorsalis pedis artery. After the ankle joint, this anterior tibial artery renamed as dorsalis pedis artery. Okay, and it runs in between the extensor hallucis longus tendon and the extensor digitorum longus tendon in between, and just in front of the navicular bone, navicular prominence, we use to palpate this artery. Okay, and here we can feel the pulsation of the dorsalis pedis artery. So now dorsalis pedis artery, it ends by giving the first dorsal metatarsal artery. This is our first dorsal metatarsal artery, and the deep plantar artery. This one is the deep plantar artery, which is going on to the deeper aspect on the in the sole. Okay, or you can say plantar aspect. And now nerve is the deep peroneal nerve. Deep peroneal nerve, this is the branch of the common peroneal nerve. Common peroneal nerve is the branch of the sciatic nerve. We all know that the sciatic nerve, just again wait for a minute. This is our sciatic nerve in green color. This is sciatic nerve, and this is the common peroneal nerve. Okay, common peroneal nerve. Now common peroneal nerve in green color, it divides at the region of neck of fibula into two. That is the deep peroneal nerve, this green one, deep peroneal nerve, and this one is the superficial peroneal nerve. Deep peroneal nerve just above the peroneus longus muscle, and then it run inside, behind the extensor digitorum longus muscle, this black one, and then it comes at the level of interosseous membrane. Now it accompanies the anterior tibial artery, this red one, and this is our deep peroneal nerve. Now both are running, but at the middle 1/3, what we are seeing that this deep peroneal nerve, green color, is on the anterior aspect. Here in the upper 1/3, it lies lateral to the artery, but here the deep peroneal nerve lies anterior to the artery, and again it becomes lateral to the artery. Actually it want to cross the artery, but it hesitate, so it is not it do not cross. So this nerve is also known as nervus hesitans because it hesitates to cross. It do not cross. It only comes in the middle part on the anterior aspect of the anterior tibial artery, but do not cross and again come to its lateral aspect. Now here is the anterior tibial artery and the deep peroneal nerve in green color. And now at the level of the ankle joint, this deep peroneal nerve, this one deep peroneal nerve gives medial and the lateral branch. Medial terminal branch and the lateral terminal branch. Now this medial terminal branch in green color, this accompanies the dorsalis pedis artery, this medial branch of the deep peroneal nerve. And here it pierces the deep fossa and become cutaneous and supply the first web space. So the cutaneous supply of the first web space is the deep peroneal nerve. And what we are seeing, this how it comes here. Okay, and this is the lateral terminal branch. This one is the lateral terminal branch, and where it is going, it is passing just below this muscle extensor digitorum brevis. The only muscle on the dorsal aspect, or you can say dorsum of the foot, is the extensor digitorum brevis. And here what we are seeing, here it goes just on the beneath of the extensor digitorum brevis and forms a pseudoganglion there and supplies the extensor digitorum brevis. Okay. So this is all about the course of the deep peroneal nerve. And regarding clinical significance, when these muscles get paralyzed, it will result into the foot drop. Okay, because dorsiflexion is not possible, then it will result into the foot drop. And now second thing I would like to explain this retinaculum. This retinaculum is what? Retinaculum is a Latin word that means to retain, to prevent the buckling of the tendon during dorsiflexion. To prevent the buckling of the tendon on the anterior aspect, there is retinaculum which retains the tendons and the muscles. So there are two retinaculum at the level of the ankle joint nearby. There is superior extensor retinaculum and the inferior extensor retinaculum. There is a 3 centimeter broad band. It is attached medially on the medial malleolus as well as the anterior border of the tibia. Here lies the anterior border. That's why it is the medial surface and this is the lateral surface. So anterior border of the tibia as well as the medial malleolus on the medial side. And the lateral side, superior extensor retinaculum is attached to the lateral malleolus and the anterior border of fibula. And the structure passes behind the retinaculum is from medial to lateral. There is one mnemonic, that is the Himalayas are not dry places. The means the means tibialis anterior. Himalayas, H for extensor hallucis longus. R means artery, that is the anterior tibial artery. Not means nerve, that is deep peroneal nerve. Dry means extensor digitorum longus. D for dry, D for digitorum longus. And the places, that is the peroneus tertius. All these muscles are going from medial to lateral. These are the arrangement and often asked in the exam. Now coming to the inferior extensor retinaculum, it is Y-shaped band. The stem of Y is attached on the lateral aspect to the the superior and the lateral surface of the calcaneum. Superior and the lateral surface of the calcaneum. And now this stem, it it is of this stem of Y has got two lamina. Two lamina, the superior lamina and the inferior lamina. It is divided. Here you can see this is one lamina and this is another lamina. Okay, this black one is another lamina, and in between these two lamina, these two tendon lies, that is the peroneus tertius in white color, and these are all black ones. These are the tendon of extensor digitorum longus. Okay, now it again unite into one, and then it give two leaf, superior leaf and the inferior leaf. Superior leaf passes superficial to the all tendons and get attached at the medial malleolus. Okay, and this inferior leaf, it is again giving two lamina. This is the superior lamina. Here you can see the superior lamina, and this one is the inferior lamina. Just to show, I have not attached this tibialis anterior. This is the, here you can see, this is the inferior lamina. This one is the this one. This is the inferior lamina of the inferior leaf of the inferior extensor retinaculum. So it carries one muscle, that is the tibialis anterior, and where it get attached, the beneath which lies extensor hallucis longus tendon and the artery and the nerve. Okay, and now it get attached over the plantar aponeurosis. On the medial side, the inferior leaf of the inferior extensor retinaculum is attached to the plantar aponeurosis. Okay, so this is the arrangement. And about the dorsum of the foot, it has got only one muscle, that is the extensor digitorum brevis, and it takes its origin from the superior surface of the calcaneum as well as the lateral surface, superior and the lateral surface of the calcaneum. And the first, it again divided into the four tendons. The first tendon is attached on the dorsal aspect of the distal phalanx of the great toe, and the lateral three tendon, 1, 2, 3 in orange color. Lateral 3 tendon is attached to the extensor hood. This is the extensor hood. What is extensor hood? All the extensor tendon, that is the extensor digitorum longus, these tendons, and the transverse metacarpal ligament, here lies the metatarsal, here lies the metatarsal. So this is the transverse metatarsal ligament. Both will unite to form the extensor hood. So these three lateral tendon attached to the extensor hood of the foot. So what will be the function? It does the extension of all phalanx of the toes. Extension of all phalanx of the toes, that is the proximal and the distal and the middle. Okay, but the first one is attached, not attached to the extensor hood. It is attached on the dorsal aspect of the proximal phalanx of the great toe. Okay, the great toe has only two phalanx, that is the distal phalanx and the proximal phalanx. Proximal phalanx at the base. So it does, only it crosses the proximal phalanx, metatarsophalangeal joint, proximal phalanx. So it does extension of only proximal phalanx, but all these three tendons does the extension of all phalanx, proximal as well as the distal phalanx. Okay, and this extensor digitorum brevis is innervated by the lateral terminal branch of the deep peroneal nerve, as I have said earlier. Okay, and it is also supplied by the arterial supplies by the deep peroneal artery, this one. Okay, so this is all about the anterior compartment of leg and the dorsal aspect of the foot. Thank you.